Hello and welcome to another episode of Aspire to Inspire. And today we have with us Miss Shweta Mandal. She's an accomplished speaker, a trainer, a coach, and a proud mother of an ADHD child. The last title, that she flaunts with pride and does her role with aplomb. Welcome to the show, Shweta.
Thank you so much, Garima, for calling me here. And I must say, you are doing a wonderful job because all of us needs lots of awareness on this topic. So kudos to you.
Thank you so much, Shweta. So let's get down to it. Your son, Neo, how old is he now?
He is 8.5 years now.
Okay, and when did you get to know that he's suffering from this condition, ADHD?
He was 2 years old and we went for a regular checkup with his pediatrician. And his pediatrician was little dicey and she said, I want you to go and visit pediatric development doctor. And we were like, why? And I've not taken that thing seriously, but yeah, obviously it was a hitting thing for us. There we came, he went under assessment, but he was very young for assessment. And there we came to know what's happening, how it's happening. And we also realized, oh, these are the things.
So before your pediatrician it out, did you ever suspect that there is something missing or some hyperactivity going on with your child compared to the peers?
Not exactly, Garima, because it was my first child, and he is my first child, so it is very difficult for me to, understand anything. Though we see many kids in our family, but when it comes to your own, the scenario is totally different.
Exactly,
So
handling the
for me,
child on
yes,
his own.
he was hyperactive, and I was always on my toes.
Right.
And one other thing was his speech, because as a 2 year old, he was not speaking the that much he should speak. So there was a delay in speech. So that was bothering me a lot.
Okay, so that was the only thing you found was not going on as per the age milestone, right? So
True,
when
true.
he
That
was
was a
diagnosed with this condition, how did you react? How much time did you take to accept it? And then how did you handle yourself after that?
so see, it almost took me a year to start the therapy. And I think because I was not agree to start the therapy, I was feeling like, no, he is perfectly fine. So but that acceptance was not coming as a mother or as a parent to me and my husband both. And I was the one who took longer than my husband did. So we just started the therapies when he turned 3.
So it must have taken an emotional toll on you. So how did you handle yourself?
See, being parents, when having a normal kid itself is not normal, and when you have a kid with special abilities, it becomes really difficult. Emotionally, you are totally drained. You're physically totally drained, and at that particular time, you don't have anyone to talk with.
Now, for all those people who are not aware of what exactly is ADHD, could you please shed some light?
So this is, I'll just tell you in a very layman language, it's just a chemical imbalance in your brain. So when it happens, normally the child is super active, or even sometimes this may affect the speech or sensory things, motor skills development. So many things are there which can be delayed. And the basic problem is the child is not able to focus because there are so many signals going on his brain, that he is thinking, should I do this, should I do that, or what should I do? So they don't think before reacting. It's just on the spot things are happening.
An
So
impulsive
for,
behavior, lot of
yeah, the
thoughts going on. Yeah.
impulsivity, true. So that's the time when, when we started the OT, occupational therapy. That time it was very helpful, and his sensory, and he was running because he was even having sensory issues. So he, many textures he was not touching.
So now, 5 years into the therapy, what are the changes and what are the challenges you still face?
5 year in the therapy, it's like, every day is a miracle, which just keep happening. and he has we are blessed that he is having a minor ADHD. It's not a very severe ADHD, though it's the challenges may differ from which state your child is. So with us, the only challenge we face two problems, which is one is like speaking, and the other one was he was very hyperactive. He was not focusing on the things. With therapy, his focus has improved a lot. He has his own YouTube channel. He's started playing piano. So he sings, he even play piano, and he is very good in making models. So
And then the music, because we have heard him play that piano and even sing. So on your
yeah,
Facebook account. So
right.
somewhere music, do you think it plays a vital role?
Definitely. See, but not all the kids will be interested in music. So I'll not say that, just push your kid into the music. You have to sit down and check it properly which area your child is interested more. So as a parent, you have to understand where your kid is good. So for me, my son was always interested in music. So
Right.
that's how, we push him more toward the music.
So some artistic things that these kids have, we as parents have to find that out. That's what you're trying to say, right?
True. True.
And recently you've started homeschooling. Any particular reason behind that?
There was a very big reason behind that, Garima. Our
Okay,
society, our schooling system.
exactly. Yeah.
So, first thing, they don't have a proper trained teachers with them, because normal teachers, it becomes really difficult to understand for them to understand these kinds of kids. The second thing, it was mostly bullying. He
Hmm.
was getting bullied, and he was getting lots of negativity.
Sorry to interrupt, just one thing. When you're saying that bullying, so bullying from the students or from the teachers?
I think from the both,
From the teachers too.
because yeah, to
Oh,
teachers too. And I never came to know, but one day, when he used to become very angry, he used to, repeating the things which he doesn't like. So even if, I'm sometime angry, so he will imitate that thing. So one day he said, I'll break your hands and leg. And I was like, what? Who told you that? I asked him.
right.
And he was very quiet and he was very scared that time. And he said, ma'am told me. And
Teacher
that was
using
a
these words.
moment I thought,
Mhm.
yeah. And that was a moment I thought, this is a time when I have to take him out from the system.
So one last question, Shweta. What is that one message that you want to give to all the mothers of this special need kids?
See, the very first thing people should understand, it is neurodevelopment difference in kids. So that doesn't mean that when I'm saying neurodevelopment difference, in normal kids also, right? Like you and me, our brain is not working in the same way, right?
Hmm.
You are a doctor, I'm a coach. We both have studied different field in different field,
Right.
right? And that's how you have to understand these kids also. The society needs to understand
Hmm.
that they may have delay in learning and thriving, but it is never like they won't be able to learn or they will not be able to make friends, and ultimately they won't be successful. So it's just treat them special, and you know just little modesty in yourself can do wonders in those kids.
That's a wonderful message, Shweta, and thank you so much for enlightening us on the various aspects of ADHD and creating this awareness. Inclusive education should not be a mere slogan, but should be a driving force in uplifting of the society and the nation as a whole. Leaving you all pondering on this thought, this is your friend Garima signing off for now. See you soon.